So before seeing my patient in the clinic, I would go into the room, do hand hygiene, introduce myself, ask my patient for their name and date of birth. Due to privacy purposes, I will not be asking her for her name and date of birth. Also in the clinic, I'd have my patient wear a gown so I could best assess them. She'll be fully clothed during this video. This is an assignment for one of my classes. My professors are going to be the only ones who see the video. Is that okay with you?
Yeah.
Perfect. Okay, my name's Kelsey and I'm your nurse practitioner today. I'm going to first start by assessing your TMJ joint. If you want to move your hair behind your ears. First, I just want to look at the joint, make sure there's no swelling or redness. If you want to go ahead and open your mouth, good. The joint is smooth. I didn't hear any popping or clicks. Did you have any pain?
No.
Okay, good. You can go ahead and deviate your jaw, or protrude your jaw, I should say, and then move your jaw side to side. Any pain?
No.
Okay, perfect. We're going to do some range of motion techniques. So we're going to start with your neck. If you want to flex your neck, chin to chest, and then extend your neck, perfect, and then rotate side to side, and then laterally bend ear to shoulder. Any pain with that?
No.
Good. Now I'm going to do neck strength. So if you want to rotate, again, I'm going to provide some, rotate that way, good. Rotate the other way, good. And then laterally bend, I'm going to push a little bit, good. Any pain?
No.
Okay, next we're going to do shoulders. So we're going to do flexion first. So go ahead and put your hand all the way up above your head, good, and then back down. Then extend it behind you, so flexion and extension. Then we're going to abduct, so go to the side all the way up, and then adduct down, and then internally rotate, touch your shoulder, and then externally rotate, put your hands up, and then kind of like you're waving, then back down. Perfect. Any pain with those motions?
No.
Good. So then I'm going to do shoulder strengthening. So if you want to shrug your shoulders as I press down, good, and then keep your shoulders shrugged, and then I'm going to press down on you. Good. Any pain?
No.
Okay, good. Also, there are a couple of different shoulder techniques that we can do. The first one is going to be painful arcs. I'm going to have you do both your hands all the way up to the side, 180, all the way up and back down. Any pain?
No.
Pain with this can indicate subacromial impingement or rotator cuff tinnitus. The second test that we can do is near impingement. I'm going to place some pressure on your scapula if you want to put your arm all the way above your head. Any pain there?
No.
Good. Any pain with that one?
No.
Good. Pain with near impingement can indicate, again, some acromial impingement or rotator cuff tinnitus. Our third test is Hawkins impingement. So I want you to put your hand flex there, palms down. I'm going to internally rotate you. Any pain?
No.
Internally rotate. Okay. Any pain with those can indicate supraspinatus, impingement, or rotator cuff tinnitus. Our next one is going to be the drop arm test. If you want to stand up and then put your hands out and slowly drop them down. Any weakness or pain?
No.
Weakness and pain can indicate, you can sit, supraspinatus, rotator cuff tear. And then we're going to do the drop cup test. So if you want to keep your arms out and then rotate them in. Any pain there?
No.
Okay, and I'm going to add some pressure. Keep your arms straight. Any weakness or pain?
No.
Weakness or pain there can indicate supraspinatus, rotator cuff tear. Okay, so we did neck and shoulder. Next we're going to do elbow. I'm going to have you flex your elbows and then extend your elbows. And then supinate and pronate. Any pain?
No.
Good. Okay, I'm going to have you try to act like you're flexing. I'm going to apply some pressure. Good. And then act like you're extending. Good. We'll do this arm. Good. Just for strength tests for the elbows. And we're going to do wrists. So we're going to do flexion, extension, and then we're going to do abduction and adduction. Any pain?
No.
Then for wrist strengthening, we're going to put your hand in a fist. I'm going to add some pressure. Any pain there?
No.
Good. Okay, then we're going to do hands. So we're going to do radial deviation, ulnar deviation. Any pain?
No.
Okay, I want you to squeeze my hands. Okay, good for hand strength. Then we're going to do fingers, finger range of motion. We're going to do flexion, make a fist, extension, and then we're going to do abduction again, and adduction. And then go back into adduction. I'm going to apply some pressure. just for strengthening. Good. Then we're going to do thumbs. So we're going to do flexion, extension, and then adduction, abduction, and then opposition. Touch each finger. Any pain? Good. Then I want you to press down. I'm going to pull up. Strengthening, strengthening. Good. And there are 2 tests you can do with the wrist to assess for carpal tunnel. The first one is Fallon's test. You can put their hands in flexion at 90 degrees, hold it there with a little bit of pressure for 60 seconds. If there's numbness, tingling, that could be a positive sign for carpal tunnel. The other test that we can do is Tinel's, which is when you lightly tap on the median nerve over the carpal tunnel and assess for achiness or numbness. Any achiness or numbness?
No.
Which could be a positive sign for carpal tunnel as well. Okay, so next we're going to do spine. So if you want to go ahead and stand up, and then we're going to do flexion, just try to touch your toes. And then extension, come back up. Great. And I want you to turn. Yep, and then turn the other way. Keep your hips straight. And then laterally bend. Oops, sorry. Yep, that way. And then that way. Good. And I'm going to apply some pressure if you want to laterally bend again. This way. Good. And the other way. Good. Just for strength testing. Then you can sit back down. So spine. And then we're going to go ahead and do hip. So if you want to lay down, I'm going to have you start with flexion, so knee to chest, and do the other one as well. And then we'll do extension if you want to flip on your belly. Extension, and then extension again on the other foot. Perfect. Any pain with those?
No.
And back on your back. Then we're going to do adduction. So you're going to lift your leg up a little bit, go over the medial, keep it straight, sorry. Over the medial line, adduction, adduction, and then abduction away. And then away again. Any pain?
No.
Perfect. And then I'm going to test for strength. So if you want to try to lift your leg up, good. Lift your leg up, good. And then press together for adduction, and then abduction, press out. Good. Okay, so that's hip. And then if you want to go ahead and stay here, we'll do knee strength tests first before range of motion. So kind of bend your knee a little bit, and I'm going to apply some pressure here. You try to bend your knee up. Good. Good. Okay, then you can go ahead and sit. And then for, I guess you could have stayed flat, I'm sorry. Knee range of motion, I'll have you stand and squat. For flexion and then extension up. And you can sit down. And we're going to do internal rotation. So the lower half of your leg you turn into the midline and then out. Other leg into the midline and out. And then for external rotation, just out laterally, then out laterally. Good. Any pain?
No.
Good. So we did knee range of motion, and we did the strength. There's also a couple different tests that we can do to test for knee injury. So I will have you lay back down. I apologize. First is McMurray's test. So I'm going to have you deflex this knee. We're going to internally rotate and come down. Testing for the medial meniscus. If we hear any popping, any pain, that could indicate injury. Any pain?
No.
Okay, we're going to go ahead and flex again. And then we're going to internally rotate it. Go down.
It feels so weird.
It's lateral. So you externally rotate for medial meniscus, and you internally rotate it for lateral meniscus to see if there's any injury there. Then we're going to go ahead, so McMurray's, we did that one, and then we're going to do MCL, so I'm going to apply a little bit of pressure here, and then just kind of lift your leg a little bit. Any pain?
No.
Pushing and pulling. And then we're going to do MCL and LCL, so I'm just going to switch my hands, apply pulling at the lateral ankle, and then pressure at the medial knee. Any pulling or pain?
No.
Okay. Back down, and I'm going to have you flex your knees up. Good. We're going to assess for anterior drawer. So I'm just going to place my hands here and kind of push or pull. Look for tibial movement. And then posterior drawer, you want to push. Look for any movement. Anterior drawer and then posterior drawer. Still going? Yeah, okay. I'm gonna make sure you're still going. And then we're gonna do Lachman's test, so if you wanna lay your legs down again. And I'm just gonna place my hand laterally at your knee and medially, and kind of just pull your femur down and your tibia up and see if there's any excursion there, which there's not. Perfect. Okay, if you want to go ahead and sit again. Okay, then we're going to do ankle range of motion. So if you want to flex your toes down and then extend your toes up. And then we're going to do eversion. So put your heels in, and then out. And then for strengthening of the ankle, I'm going to have her do plantar flexion and dorsiflexion. So plantar, you're just going to push down on my hands, and then dorsiflexion up. Perfect. Okay. Oh my God, a breath me. So then we're going to do the reflexes. We're going to start with the brachial. That hurts me. Okay, then we're going to do triceps. Rest it in here. Oh, a good one. Okay. Then brachioradialis, 2 inches above the wrist. And then patellar, right below the knee. Might need to see this. I think they can see it. Yeah. And the Achilles will just be right below the knee, or the ankle. I don't know if you want to, I just did it right here with the flat side. Okay, next we're going to do the cranial nerves. Okay, so the first cranial nerve is the olfactory nerve. So if you want to close your eyes, I'm going to close one nostril. Sorry if that hurts. Can you tell me what you smell?
Peppermint.
Perfect. Can you tell me what you smell?
I don't know what it is, but
You'd like to describe it?
earthy.
Yeah. And then the second cranial nerve is optic. So I'm going to look at your optic disc with my ophthalmoscope. Okay. Good. Then we're going to do confrontation testing. So if you want to close your right eye, and just tell me when you can see my fingers wiggling.
See him. See him.
Okay, and then I'm going to close my other eye if you want to switch to yours.
Can see him. There.
Okay, and then both you should be able to see it very easily.
Yeah, there. And there.
Good, perfect. And then we're going to assess 3, 4, and 6, we're going to do optic and oculomotor. I apologize. So we're going to do, look at your pupils, make sure that they are round and reactive. I'm going to do the light. Direct and consensual. Direct, consensual. And again, this is optic and oculomotor. And then we're going to do convergent, so just follow my finger. In a combination, look at my finger and look back at the wall. Good, finger back at the wall. Finger back at the wall. Finger back at the wall. Perfect. Then 3, 4, and 6, oculomotor. Trochlear and abducens, that's going to be the cardinal gazes. So I'm going to have you just follow my finger. Perfect. And then 5 is going to be trigeminal. So I'm going to have you, first I'm just going to palpate your temporal and masseter muscles. Then go ahead and clench your jaw. Perfect. And then move your jaw side to side. Good. And then close your eyes. I'm going to have you tell me if it's a sharp feeling or a dull feeling.
Sharp. Sharp. Sharp.
Yeah.
Dull. Dull.
Sorry, that was in your hair.
No, sharp. Dull.
Okay. Keep your eyes closed. Tell me when you feel a touch.
I felt. Do I just say where?
Yeah.
Oh. What was my forehead? Chin. Chin. Forehead.
That was light touch. You would also do corneal reflex, but I'm going to omit that for this video. Then 7 is facial, so I'm going to have you smile, frown, eyebrows up, and then you can do your cheeks out. I don't know how to say that. And then 8 would be acoustic. So I'm going to kind of get behind you and whisper 3 things. Just tell me what I say.
W2L.
6, 8.
6, 8.
Okay.
Sorry.
Perfect. And then 9 is going to be glossopharyngeal and vagus. So her voice or her speech has been clear. Her voice has been clear. Do you have any trouble swallowing?
No.
No. Can I see your uvula? Okay. You'd also do the gag reflex there, which I'm going to omit for this video as well. Then you would do spinal accessory. Just looking at her muscles. Everything's even. And then I'm going to have you go ahead and shrug up. Good. Look to the right. Look to the left. And then look to the right again. I'm going to apply some pressure. Look to the left again. I'm going to apply some pressure. Good. And then 12 is hypoglossal. I'm going to have you put your tongue out. Then move side to side. Perfect. Okay. Thank you.